Today, I'm talking with Dr. Alina Sholar. She's a plastic surgeon, and she's shared some of her concerns on social media about the risks and dangers of medi-spa treatments. Just to tell our audience, how long does it take to become a plastic surgeon?
The other day I had somebody actually solicit me through email asking if I could train them, and they had failed at a nursing school. And I said, if you really want to do this, you do what I did, which was 4 years of college, 4 years of medical school, 7 years of residency, and then continuing medical education after that with my board certification in plastic surgery and ongoing CME. And she stopped right there. But I tell people it's not just because I was slow that it took this long. It really takes that long to master, to learn the anatomy, to learn how things can go wrong, and really importantly, what to do if things do go wrong.
You needed that training and that background to be safe, and there are no safe shortcuts, and we're seeing patient deaths. The most recent incident that we've heard about is the death of Jennifer Cleveland, a 47-year-old woman that went in for some type of treatment at a medi-spa there in Wortham, Texas. The owner of the medi-spa is listed as Amber Johnson, and she claims that she is a, quote, certified practitioner on her website or on her Facebook profile, but we have no idea what that means. And she has a medical director that's supposedly in charge, but he's a long, like 100 miles away. So talk to us about what you know about this sort of scenario. Obviously, we don't know the details. We're just speculating. But what are your thoughts just when you hear about a situation like this?
Yeah, the red flags here are, first of all, this is a medical practice owned by a layperson. So problem number one, the med spas are actually medical practices defined by the practice of medicine. So you have a non-qualified person owning a medical practice. That's the first issue. Second issue is you have a medical director in name only. So this person is plastered all over their website, but is 100 plus miles away, not directly on site, not overseeing what's going on. And they themselves don't have the training to really truly supervise this person performing these procedures. So the letter of Texas law is that if a physician delegates a certain procedure to a non-physician, they themselves have to be able to supervise, and they have to be able to be knowledgeable about that procedure in order to supervise that person. So that's problem number two. Problem number three, nobody in that med spa apparently was trained to do CPR, because CPR was not started until the paramedics arrived. We've heard some from the patient's family, but a lot of it's speculation, and we'll see when the coroner's report comes out what really happened. But regardless, there was just a lot of really shady shenanigans going on in this medical practice, and there was a physician that's the gatekeeper that was not gatekeeping. We have an issue, of course, with the layperson owning the medical spa, but the physician is culpable and complicit when they are allowing this to happen. Somebody's allowing their name to be used to order Botox. This happens all over the place. This is not an isolated incident. You may have seen it here in Texas. There's a company that's advertising that anybody can do Botox, and they literally have these two girls saying it's no big deal. It is a big deal. It's a very, very big deal. And they're advertising, hey, anybody can do Botox. We'll give you a medical director. Again, these physicians that are complicit, that are acting as medical directors in name only, physicians, I am telling you right now, you are a problem. So it's not just the layperson's the problem, it's the physician gatekeeper that's the problem. We have to get these physicians ethically, morally doing no harm.
It is a medical ethics issue for me. And sometimes people criticize me because I get really vocal about some of this stuff. In particular, I'm really an opponent of this IV infusion stuff.
IV infusions aren't innocuous, and I think that's what the public doesn't understand. Yeah, you may think you need an IV after a hangover, but in actuality, if that's the case, a physician needs to be there to actually medically evaluate that patient, to ensure that patient is safe to get that particular IV fusion, and they are watching over what's exactly going in that IV fluid bag. But In most cases, you have a lay person, maybe an RN, mixing up this cocktail, putting it in an IV bag. Nobody's there to evaluate this patient, and they are patients. They are not customers at an IV drip bar. There's nobody watching. It's unfortunate that this poor woman died, but I hope this brings some public awareness to the fact, first, that med spas are out there that are operating really outside the letter of the law. Two, that the law should be shored up to ensure adequate supervision, but also that the IV therapy is not necessarily an all grand and safe venture, that you really have to have a physician there watching.
Sometimes people will say, well, if the patient consents to it, but I don't think that these patients are getting true informed consent, because if you were, you would explain to them the benefits, which are almost none, the risks, which are there. And so, when it comes to medical ethics, and speaking of supervising physicians and the doctors out there that are offering these types of products, and I know they will try to tell themselves that, well, I'm trying to help somebody, but you got to look at the medical ethics of beneficence and non-maleficence. And, are you potentially harming someone with this? Even if they feel subjectively better, you're the expert and you know that this is not scientific and that this is not right. So, I just think we really need to stop thinking about making people happy when what they think might make them happy could actually hurt them or even kill them. If you're going to go to one of these medi-spas, make sure that you know the credentials. Like, for example, Amber just calls herself a practitioner, but what the heck is that? We don't even know if she even has a nursing background. Is she a nurse practitioner? We don't know. A practitioner means nothing to us. So you need to look for credentials. That means those letters behind the person's name. MD or DO, that means physician. Or are you seeing NP or RN or nothing? You need to know what that is. And, really you need to put your safety as a top priority. These are medical procedures, not wellness products.
The other point here being that the term med spa, encompasses a lot, but we also see the same problem with cryotherapy clinics and ketamine clinics and weight loss clinics and low testosterone clinics. Now regenerative medicine and stem cell clinics. So you'll see a lot of wolves in sheep's clothing, these medical practices that are really disguised as being these innocuous wellness ventures, but in actuality, they're practicing medicine.
Basically, we need to have a buyer beware philosophy, because we obviously at this point cannot be sure that any authorities are protecting us. So we really need to go that extra mile to protect ourselves. What I would say, which I always tell patients, even if you're seeing a physician, get a second opinion, especially before you're going to have something injected into your body or a surgery, unless you're very, very confident with the physician. Certainly if it's a non-physician, you really need to see a doctor and get a second opinion before you enter into anything that might have potentially life-threatening risks.
Yeah, definitely buyer beware. In the past, physicians have really been too quiet on this issue as well, where they kind of want to hang back. They don't want to tell on other physicians. Well, now's the time to speak out. If you're an ethical physician, you need to be on the forefront with this here thing and not being afraid. I understand completely where people are coming from, where physicians are coming from, saying, oh, I'm going to get repercussions from the nurse practitioners. I'm going to be doxxed by the PAs. It doesn't matter. Okay. And I'm really 100% firm on the, I understand that you're scared, but that's why we're here as an organization at PPP and Texas 100. We're here to support physicians who want to stand up and do the right thing and speak out publicly about it. I've been doxxed. Heck yes, I have. But that's okay, because I'm on the right side of this issue here. They can, harass me as much as they want, but the fact is, all of us physicians, this is what we're supposed to do, not just see patients every 10 minutes of the day. Our job as a public health expert is to ensure that every patient is safe. Physicians, come on now, it's time to get this game. We have to stand up against what's going on here.
If you're a physician, please join us in standing up for patients. You can visit our website and join at physiciansforpatientprotection.org.